clinical examination in critical care. Okay, so that is the topic of the video that we are going to be doing today. This video will only be focusing on the structure and stepwise approach to the clinical examination of a critical care patient. This video will exclude any management as well as treatment, because that will be covered in detail in our later videos. Okay, so we are going to use the alphabet from the letters A to I, and each letter will represent a different step in which to remember in which order, as well as not to miss out anything important when you are examining a critical care patient. Okay, so starting from A stands for airway. And under airway, there will be three main things that we're going to be asking for or looking for. Okay, number one is the airway patent. Number two, is the end tidal carbon dioxide trace normal? And number three, are there any signs of airway obstruction? Okay, once you're done observing and examining the airway, we are going to move on to B. B stands for breathing. So ox, is the physiology normal? So basically the SpO2, respiratory rate, and tidal volume, are they within normal parameters? What is the level of support that the patient is on when it comes to breathing? For example, are they on a bag mask or ventilation? Or also in this step, you can also assess whether they would be needing that, okay? And are there any abnormal signs on your chest examination? Review the ventilator settings, arterial blood gases, as well as your recent chest x-rays, if those are available, okay? And C, circulation. Is the physiology normal? So basically, essentially, that is your heart rate, blood pressure, peripheral temperature, lactate, as well as your urine output. Okay, and if some of them are deranged or out of the normal, then you know there is a problem with the circulation. Also, at circulation, we want to know how much support is required. So would they be needing an inotrope or a vasopressor? Okay, under D stands for disability. And over here, we want to know the level of responsiveness of the patient. So here, we basically do the GCS or Glasgow Coma Scale. We want to screen for delirium. We're going to check the pupillary reflexes or responses, as well as your doses of your sedative drugs, okay? Under E, that is either your environmental, enteral, or exposure, okay? That's what it stands for. We're going to check for the feeding regimen, stool frequency, abdominal tenderness, or bowel sounds, and whether those abdominal tenderness and bowel sounds are present or absent, okay? F stands for fluids, okay? Fluids and also electrolytes, as well as your renal system. So what is the fluid balance? What is the urine volume as well as the color? Is there any edema? And then you also have to review the renal biochemistry and electrolyte levels, okay? So you will do that through your further investigations. G stands for glucose. So what is the glucose level, and is insulin indicated, and also is it being administered, okay? H stands for hematology. So what are the hemoglobin and platelet levels, and are there any signs of bleeding? And lastly, I, that we have to check for, stands for infection. So what is the temperature of the patient, and review your recent infective markers and trend. So those would be your ESR, CRP, WCCs, okay? You would get that from a simple blood test. And then also what antibiotics are being given, and what is the duration of this treatment, okay? So in summary, the clinical examination in critical care would be from A to I. Airway, breathing, circulation, disability, environment or exposure, fluids, electrolyte and renal system, glucose, hematology, and infection.